Welcome back to Healing Eve. Or if you're new, my name is Dr. Obi Ide, and this is Healing Eve. This is a platform where you are loved, you are enough, you are unique. Today, we're going deeper into the difference between living without disease versus living with health. Now, very often, we tend to think of health as living or dwelling in hospitals. It's a place of health care. I actually absolutely love the phrase that my mentor, Professor MC Asuzu, uses. He's a clinician, he's a public health doctor, he's a professor, but he taught me that hospitals are disease palaces because that's what we do there. We deal with disease. So health, your health, my health, is not in a hospital. It's wherever you live, your community, your home, where you work, where your children go to school, the marketplaces. That's where health is found. Now, what are the major components of that health? The food that you're eating, the water you're drinking, how much exercise or mobility you have, how well you're sleeping. Are you gaining enough sunshine? How are you managing stress? These are the components of a healthy lifestyle. Now, one of the things that we need to understand is health as practiced in clinical medicine is very poorly structured. We need to understand that the ideal way in which the healthcare system works for you and I is in the paradigm of community medicine and nursing. What does that mean? It means that there is a statutory staff of the government who knows you as part of his or her catchment area, who is aware of the number of people within her catchment area, how many of them are less than 5, how many of them are in the reproductive age, how many of them at any time are pregnant, how many of them have chronic diseases. She knows who those are. She goes to visit them. She goes to ensure that their home environment is working for the optimal management of their disease. That is healthcare at its premium. Falling ill and going to the hospital is not healthcare. And the fact that we are unable to see and experience what I'm just describing is a result of several different factors. A big part of it is the fact that we as doctors, we love to see you all. We love to have you come in and we get to the bottom of your problems, but that's not health. Another important part of why community medicine and nursing doesn't really function as well as it should is because hospitals and clinicians that staff those hospitals were actually trained to do so by big pharma. Giving you drugs helps to keep the beast alive and well and functioning, but it's not healthcare. So we need to be able to determine what works for us, what keeps us in the optimal state of health, and what will keep us away from the hospital. So, as a new medical student in the University College Hospital in Ibadan, I was, of course, just enamored with everything that was medicine. I actually was looking forward to long, very robust career in clinical medicine. And when I was done and graduated, I had decided that I was going to be an obstetrician and gynecologist. Now, going through medical school in Nigeria, there were things that I knew I was not getting to experience. There were gaps, there were voids. And so I wanted to go to the US of A so that I would experience medicine at its peak. And I did. I got the opportunity to. And then when I came back, I wondered, why isn't medicine working in Nigeria? What's missing? Why do we have such poor healthcare? And at first, I was so sure that it was because there was not enough money. Money was not being spent where it ought to be. All the politicians didn't care. And I took a full year and a half, almost two, to answer that question. And once again, my mentor, Professor MC Asuzu, came to my aid and helped me to remember all that I'd been taught about community medicine and nursing. Those key elements of health: food, water, sleep, sunshine, stress management. Those key indices are the things that are within the ambit of community medicine and nursing. Within your environment, those who practice community medicine and nursing are looking into these key indices to see how they are working for you and how to improve them. So if you don't have a robust community medicine and nursing healthcare system, and all you have is clinical medicine, you fall sick, you go to hospital, you fall sick, you go to hospital, you're not going to be healthy. That was the big abyss that I finally got to understand about how we are living here in Nigeria. We do not have the money to run healthcare the way they do in the US. Community medicine and nursing is actually the bedrock of the UK system, although it might not be recognizable anymore because of NHS and everybody going to the hospital. But where you have staff who are looking at how to keep your health indices and the central tenets of health optimal, then your population is healthy. So, back to what we started talking about in our first episode: food. The things that we eat become part of us. So it is critical that we look at what we are putting into our mouths with great wisdom and clarity. Now, unfortunately, we are guilty of telling the populace that you're meant to eat 3 meals a day. In fact, breakfast is the most important meal of the day. It's not true. Why is it not true? It's not true because the way the body works optimally is for the cells to actually be in a state of fasting for the larger part of the day, to be able to clean up a lot of the damaged cells, to get rid of broken proteins, and to have a certain window in which nutrients are being supplied to the body. What is that process? It's called intermittent fasting. And in the last episode, I teased you by saying that 1 meal a day is not suffering. And it's true. 1 meal a day is not suffering. If you are eating a very rich, high quality meal, what you have done is giving your body the opportunity to cleanse itself for most of the day. Now, I know, coming from where we all are, man, we're all Nigerians now, how we eating 1 meal a day. This is the beginning point. 8 hours a day. That is the window within which you eat your meals. And without a doubt, no snacking. What is the process behind having your meals within 8 hours and no snacking? You're trying to increase the sensitivity of your body cells to insulin. Insulin is a hormone that is released every time you eat. It doesn't matter what you eat. We have fed, unfortunately, most people the idea that insulin is released when you eat sugar. That's not true. Anything you put in your mouth will cause insulin to spike. And the more you are spiking insulin, the less your body is able to be sensitive to it. That is what is known as insulin resistance. So if you are training your body for 16 hours to be without food, and then you eat within that 8-hour window, you are beginning to regain insulin sensitivity. And that's how you are able to reduce the likelihood that you will develop all these diseases that are linked to insulin sensitivity, chief of which are diabetes and high blood pressure. So, first of all, no snacking. Next, eat within an 8-hour window. And then gradually, you begin to shrink that 8-hour window. 7, 6, 5, 4, as best as you can. And you will sleep better. You will have much more energy. Your mental state, your mind will be clear, and you will begin to live the best life possible. So, what other 2 things can you do in this week other than starting to reduce the hours in which you're eating to begin to live your best life? First of all, drink water. We are so used to going around dehydrated in Nigeria. It's usually hot. Even when it has finished raining, it's humid, it's hot. Drink water. The last, exercise. Does wonders for your mind, helps to keep your joints mobile, helps to keep your heart supple and pumping. And if you do it with those around you, it's a great bonding experience. I love every one of us listening to me here to take up one form of exercise. I don't care whether it's walking for 30 minutes. If you have exercise access to a pool, that's even better. Swimming, if it's popping in a YouTube cardio channel and doing some cardio workout, stretches, exercise ball, I don't care what it is. You benefit from doing some form of exercise 3 times a week. So, which one are you going to start? I'm looking forward to hearing from you. I'm looking forward to seeing all the good that these tips that I'm sharing with you are going to bring to your life. And believe me, we are just starting. Remember, you are loved, you are unique, and you are enough. See you next time on Healing Eve.